If you've ever been in a situation where tear gas is deployed, you know how disorienting and painful it can be. That burning in your eyes, the choking sensation in your throat, and the uncontrollable coughing can cause panic. But panicking is the last thing you should do. Knowing the right first aid steps can make a massive difference in how your body recovers. So, if you've been exposed to tear gas, acting fast is crucial to protect your lungs and minimize harm. Today, we're going to walk through exactly what you need to do, step by step. First and foremost, your absolute priority is to get out of the contaminated area. This might sound obvious, but in the chaos, it's easy to get disoriented. Look for the direction the wind is blowing from and move upwind. The gas cloud will travel with the wind, so moving against it gets you to fresh air faster. If you're in a dense urban area, try to get to higher ground. Tear gas is heavier than air, so it tends to settle in lower areas. Getting to a second-story balcony or even just up a small hill can provide significant relief. Once you start moving, try to control your breathing. It's a natural instinct to gasp for air, but taking large, deep breaths will only pull more of the irritant deeper into your lungs. Instead, take short, shallow breaths. Think of it as sipping air, not gulping it. This minimizes the amount of gas you inhale as you make your escape. Once you've reached a safer area with fresh air, the decontamination process begins immediately. The chemical compounds in tear gas are sticky and will cling to your skin, hair, and clothing. The first step is to rinse your mouth and nose. Use clean water, like from a water bottle. Tip your head back and to the side. And gently pour water into your nostril, letting it run out the other side. Do the same for the other nostril. Then, take a mouthful of water, swish it around your mouth thoroughly, and spit it out. It is absolutely critical that you do not swallow this water. Swallowing will introduce the chemicals into your digestive system, which can cause nausea, vomiting, and other internal issues. Just swish and spit repeatedly until the burning sensation begins to subside. Next, you need to address your skin and clothing. Tear gas residue on your clothes can continue to release irritants, a process called off-gassing, which means you'll keep re-exposing yourself and anyone around you. Carefully remove any contaminated clothing, trying not to pull it over your head if possible. If you must pull a shirt over your head, try to turn it inside out as you go to trap the contaminants. Place the clothing in a sealed plastic bag. Once your clothes are off, rinse your skin thoroughly with cool water and a mild soap if available. Pay special attention to your face, neck, and hands, but try to rinse your entire body if you can. A cool shower is ideal. Avoid using hot water, as it can open up your pores and allow the chemicals to be absorbed more easily, which can intensify the burning sensation. After you've moved to fresh air and started decontaminating, focus on calming your body and your mind. The experience is stressful, and stress can make symptoms feel worse. Sit down and try to regulate your breathing. Now that you're in fresh air, you can transition from shallow breaths to slow, deliberate, deep breaths. Inhale slowly through your nose, hold for a second, and exhale slowly through your mouth. This helps to calm your nervous system and can also help your lungs expel any remaining irritants. You can also slowly sip cool water to help soothe your throat, which is likely to feel raw and irritated. Milk is sometimes suggested, but plain, cool water is the safest and most effective option for rehydrating and soothing your throat lining. Finally, and this is the most important part, you must know when to seek professional medical help. For most healthy individuals, the effects of tear gas are temporary and will resolve within an hour or so after getting to fresh air. However, for some, it can be much more serious. If you have a pre-existing respiratory condition like asthma, COPD, or bronchitis, you are at a much higher risk for severe complications. If you experience a full-blown asthma attack, or if your symptoms like severe difficulty breathing, persistent chest tightness, wheezing, or disorientation don't improve after 20 to 30 minutes in fresh air, you need to seek emergency medical care immediately. Don't wait. These can be signs of a serious reaction that requires a doctor's intervention. Always prioritize your health and safety. Thank you so much for watching. We hope these tips are helpful and keep you prepared. If you found this information valuable, please give this video a thumbs up and consider subscribing to our channel for more content. Stay safe out there.